your disability rep, Roy Rickstrew. Good to see you as always.
Good to see you, Tom.
All right, we're going to talk about Medicaid and Medicare.
Yeah, that's correct.
And if you're on one, do you go on the other? And how does that all work?
Yeah, that's pretty well the case. A lot of people have Medicaid. They hit 65. They've been on disability for 24 months. They become eligible for Medicare.
Okay.
And I get this question pretty often. You know, I do the Social Security disability.
Yes.
I'm also a licensed Medicare agent. And for me, it made sense. You know, when my disability clients become eligible for Medicare, it's a continuation of service. Lots of questions about another government program. And so I try to keep servicing those clients, you know, through their Medicare. Yeah. I do it for other people too. So if you're out there and you have Medicare with questions, you know, keep us in mind.
All right. Well, what's the difference between the two?
So Medicaid is aid from the state, is the way that I think people keep this straight a lot of times. So it comes from Missouri, also called Mo Health Net. And it's going to be for folks that are pregnant women and children, the aged, blind, the disabled, people who are low income. There's categories of eligibility and different Medicaid programs for each of those categories.
Okay.
Medicare, by contrast, comes from the federal government. It's that red, white, and blue card that a lot of us have seen.
Right.
You get that when you turn age 65. If you've been on Social Security disability for 24 months and payable, you become eligible for Medicare. If you have end-stage renal or Lou Gehrig's disease, Lord forbid, you qualify for Medicare early.
Okay.
So that's kind of the difference. Care for the elderly from the federal government, aid from the state for the poor and for the disabled.
Okay.
So a lot of times what happens then is people are on Medicaid and they become eligible for Medicare. The problem is that some of these categories for Medicaid have an uninsured requirement. And so you have to be uninsured. And when you become eligible for Medicare, you're no longer uninsured and your eligibility for Medicaid then ends.
You have to drop one to get the other.
Pretty much, yeah.
Okay. Is that all programs or did you do some of them?
Where you're most likely going to see this is folks that are on the AEG program, the Adult Expanded Eligibility Program.
Okay.
It was part of the Obamacare, for lack of a better term. It was part of the expansion project.
Yeah.
Easy to qualify for. A lot of people got thrown on it. When they become eligible for Medicare, the state will find out at some point and they'll move to terminate or close that program out.
Okay.
Other Medicaid programs end at age 65. And so if you're on like the Ticket to Work program, where you're able to work and draw a Medicaid benefit, Medicaid says, gosh, when you hit 65, you're not really a worker anymore, you're a retiree, and so that program ends at age 65, again, forcing you onto Medicare.
Okay. You know, see, when you talk about these things, the first thing I think of is that's why I need to talk to you, because I'm confused already. I just understand Medicaid, state, Medicare, Fed, and one may stop, but not all of them. And so you see, I'm confused right away.
Some levels of Medicaid actually help you get more benefits out of Medicare. So kind of the takeaway here is that if you're turning 65 and you're on Medicaid, you really need to reach out to somebody who understands these programs for some guidance to see what kind of impact there's going to be. So for a lot of people on Medicaid, they've had $0 copays, they get prescriptions for free. When they transfer over to Medicare, they start seeing $185 a month premium. They start seeing deductibles that are built into Medicare. They start seeing a bigger copay on the Medicare. It's a huge shock for people.
Yes.
And
but it is coming for some people.
It is.
It's not anything you could say, no, I don't want to do that.
No, and the reason why we're doing the show is a lot of people get caught, pardon the vernacular, with their pants down.
Yeah.
And it's really a shock and a traumatic event for a lot of people.
None of it is free. I mean, whether it's a shock or not. Okay, there you are. You have so many, I mean, just talking now, so many different things that you do for folks here.
Yeah.
And they can contact, I mean, they talk to you.
Yeah, that's correct. You know, 26 years I've been working on the Medicare, the Medicaid, and the Social Security disability aspect of things. The programs kind of all dovetail and they fit in with one another. Sometimes they don't fit real well. The puzzle pieces don't always fit real well.
Yeah.
And that's where people get in trouble. They get caught with this big surprise and it costs them a ton of money, or they end up with periods that they're not really well insured. There's a better way, and you start that by giving us a ring here at the Your Disability Rep.
That's right. Give them a call. Your Disability Rep, Roy Rickstrew, he can find you the right path.